Well, good afternoon, everybody. Welcome to FSU Coach Live. My name is Dr. Tim Baghurst, and it's great to be back. We took the summer off for a break interviewing people, and we have a full schedule lined up for you this fall. And our first guest is Dr. Derek Burgess. Thank you so much for joining me, Derek. If you wouldn't mind, just share a little bit about how you got to where you are today.
Sure. Well, thank you first for having me.
Of course.
As you mentioned, I'm an orthopedic surgeon. I'm from Muscle Shoals, Alabama originally. I went to undergraduate at Xavier University in Louisiana. That's where I did my undergraduate study. I did my medical school as well as my surgical training at Howard University in Washington, D.C. I followed that by a one-year fellowship in sports medicine at Cincinnati Sports Medicine and Research Facility. And then now I'm back in the South again. I'm in Laurel, Mississippi, practicing orthopedic surgery and able to do what I love as a team physician.
Yeah, I'm curious, why did you want to go into the sports field when there's so many other fields?
So I had an early exposure to orthopedics through an unfortunate injury as a high school student. As a junior, I injured my elbow. However, the opportunity gave me the ability to walk into an orthopedic office and meet one of my earliest mentors, Dr. John Young. And I expressed interest at that time in going into orthopedics, and he welcomed me into the office. And I started to go back to mentor and to shadow him during my senior year of high school and kept coming back during undergraduate studies. And once I decided to go into medical school, orthopedic surgery was a perfect fit, and it just worked out for me.
I just want to remind everybody that if you do have a question and you're watching live, just throw it in the chat box and we'll make sure we get it to Derek. Now, some people might say that healthcare is largely supported by sports in the sense that we see so many injuries across, well, it used to be just young athletes, but now we're seeing even older athletes participating in masters events and so on.
Yeah.
What are you seeing in terms of the people coming through your office needing treatment? All ages?
Yeah, so I treat all ages of athletes and people in general. But what you're mentioning is we start to see a lot of injuries in younger athletes that we would typically see in your high school or college age. But my practice spans from young athletes to professional athletes and all in between. I treat a lot of high school athletes as well as a lot of college athletes. And some of the injuries that we would typically see in the college realm, I'll see now in 10, 12-year-olds.
Why? Why are we seeing that?
Well, I think that one thing, we do a better job of diagnosing injuries now. We have better technology. We have easier access to MRIs and things of that nature. I think when you talk to a lot of old athletes, they'll talk about their knees having fluid on them, and they would just get the fluid drained and go back and play, and never had an MRI to know that you had a meniscus tear or an ACL tear. But now we have the diagnostic tools to make that diagnosis earlier. I do feel that our children are different in the fact that they play a lot more sports, but they do not do as many just playground activities like we did when we were children. And, many times sports are the only exposure that they have to just physical activity. And many times students are playing the same sport year round, several seasons of the year, fall, spring, summer, and never really truly have an off season.
Yeah, I was going to ask you about that. We have that specialization problem, and
Right.
we also have perhaps the overtraining problem.
Mhm.
We do this same motion over and over and over again. For example, I know swimmers, it's really hard to cross train in swimming by doing a
Right.
different shoulder activity that replicates swimming. Is this a growing trend? Is it stabilized, or is this something that it's just going to keep getting worse until we educate more parents and coaches?
I think it's a growing trend, but our job as coaches and as medical providers is to educate, number one, to be able to share the new research and show, when I first got into the field with orthopedics, it's only been about 10 years. However, at that time, people were going back from an ACL injury on average in less than 6 months. And now in 9 months and 12 months, because the more data we get to know, like if you go back early, you're at higher risk of injury. And we have to share that information with coaches, with our athletes, with their parents, so that they can make a great decision when it's time to get back to your sport.
Mm. Certain sports, at least historically, are known for being more likely to produce certain types of injuries. Um, Women's soccer, for example, is well known for
Absolutely.
ACL injuries and certainly hamstring tears and things like that. Do you see specific sports being more at risk for traumatic injuries that might be surprising to some?
Well, I definitely believe, like you mentioned, the things that we see a lot of knee injuries are women's basketball, soccer, and men's sports. We see it in basketball, we see it in football when you're making those change of directions. 70% or so of ACL injuries are non contact injuries. So, you can be running, changing direction really quickly, and that's when we see those injuries. Of course, football is a very violent sport, so to speak, high impact. That's why we're on the sideline, because at any moment, anything could happen, from a broken bone to a major head injury or a ligament injury that needs attention. So we are always present as a sports medicine team. Even if you don't see a physician, you will see athletic trainers on the sidelines or physical therapists on the sidelines, so that we can make an early diagnosis, especially if you're not safe to go back to play on that same day.
Yeah, you talked about extending the length of time to recover from an injury, and that almost sounds like some kind of sentence to an athlete or coach
Yeah.
in the respect that they want to get straight back on the field or wherever they're performing. How do you how do you mitigate or balance that, the fact that those athletes and coaches really don't want to listen to those numbers they don't want to hear, versus you've got to look out to the best interests of that athlete? Where do you draw the line? Are you because let's face it, if you tell me 12 months,
Mhm.
I'm going to go through the stages of grief right now.
Right.
So how do you help facilitate that to make sure that that athlete is ready to go back to play, but isn't just kind of a, I'm either going to ignore you or I'm done.
Yeah. So that's a complex question, and but that's real life, and that's what I deal with when I have to knock on the door and walk in and tell a 14, 15, 16-year-old, hey, your career is over for this year. There's no more basketball for you this year because you've torn your ACL. And then you have to, first, I have to build a relationship to let them know that I am in it with you and that I have your best interests in mind no matter what. I'm here for you as an athlete. I'm not necessarily here for the university or for whoever. I have to make sure that you are ready, and you will go back to play when you are ready. There is some subjective data and there's objective markers that we go by. But I tell the kid, all right, I've given you this diagnosis. I know that nothing else that I say today you're going to hold on to. So
Right.
go home, cry, get it out, do whatever you have to do, and then come back. Let's sit down and talk, and then let's go to work. I can do the surgery, but there's so much part on the rehab that I cannot do for you. You have to own that. And that's difficult when you're dealing with teenagers or even 19, 20-year-old kids that are fighting for their scholarships or, fighting for a livelihood, because for many people, this is their ticket to get them into school or to get them onto the next level. So it's difficult and it's very complicated. But I think the first thing is you have to establish a relationship and build that trust to let them know I'm here with you. There's going to be dark days. You're going to want to give up for sure, but I'm here with you along the path.
That's an excellent point. And I, when I think about this as well, I was speaking with a parent recently about their son being out for substantial amount of time with injuries, and he told his son, this is now your competition. This is your training to
Absolutely.
achieve success. And if you treat it that way, it then makes it okay, I'm going to training rather than I have to go for therapy because I'm broke. And
Right.
that perspective I thought was a different way of looking at it, rather than, there's something wrong with me and until I'm better, nobody's interested.
Right. And I tell young athletes, I can get you back stronger simply because you've never really worked out to the extent that you're going to have to work out to overcome this injury.
Mhm.
Many times when you're working out in a high school setting, you're doing a couple of exercises. Anybody who's smart enough knows that they can get lost in the gym, skip some reps. But
Mhm.
when you're one-on-one with that therapist, you have to hit every rep. You have to concentrate on your technique. You have to do things the right way. So I've seen athletes come back and go to their gym and start working out with their team, and they're like, "How did you get so strong? Coming off an injury." Because they had to lock into the training process and not just be distracted by so many other things. When preparing for the next game, doing your rehab, that is your next game. Showing up each day, giving your best, competing with yourself, because you are the only person, the man in the mirror is who you have to compete with when you're trying to get back on that playing field.
It's a great point. Coaches are typically who we work with in our degree program, our master's program, and we show these videos within our program. It's hard for coaches, right, who have an athlete that gets injured. And what I see, unfortunately, too often is a player gets injured, right? Derek, you get injured. I'm your
Mm,
coach, and now you're dead to me until you're back healthy.
right.
How do you help facilitate that? Do you communicate with coaches at all, or is it just working with the athlete? Because I think this should be, in many ways, a team environment to help that athlete get back.
It is a team 100%. And one thing that we've been able to develop in my sports medicine department is that we have a sports performance program. And that's something that's missing in athletics on many different levels, because you have a kid that gets injured and they have 3 to 4, sometimes 6 weeks of physical therapy, and then maybe insurance stops paying for it. So now
Right.
you have a kid that's sitting on the couch 3 months out from surgery. You told them they can't go back to play until 6 to 9 months. The coaches don't feel comfortable with rehabbing them at school because they don't have the equipment and sometimes the knowledge of where is this kid along the process. So you definitely have to have communication with your athletic trainers, communication with the parents, the coaches, for professional athletes, for their agents, so everyone is on the same level and understanding of what's going on. And hey, we're all in this together to get your athlete back to play when it's safe for them to go back.
You're around a lot of different athletes. You talked about going from pro all the way down. Um, Given what you see with athletes and their injuries, what advice do you have for an athlete that has been injured and is looking at a kind of a bleak outlook for the foreseeable future? What characteristics do you see in those athletes who do get back and do get back stronger that they need to try to replicate?
Yeah, so the mental piece of it is very important. Mental toughness is very important. Number one, you have to accept that this is where I am. I always tell athletes, you didn't determine your injury by a schedule, right? So I cannot tell you that opening day you're going to be ready. You're going to be ready when you're ready. You have to first accept that this is a major injury. When I sit down and talk to a teenager or a young adult and say, "Give me a year of your life to get back," for many things you've never concentrated a whole year in a row on anything. So it's a daunting task. But first, being able to accept it and just know that each day you have to show up and try to be 1% better than you were the day before. Your only competition is truly yourself. And being able to, once you get back to a certain level, you have to be able to trust that I am ready to go back. And that's why we try to put you in game like situations during your training, so
Okay.
that you can get your mental toughness, or your mentally get ready to go back out and not be worried about, okay, can I stick this leg in the ground? Can I cut? Can I pivot? When it's time to go back to play, you really need to be able to trust your repair, whatever it may be, so that you can safely go back and be the person that you were before. And it's really hard to predict when that'll happen. Some people just say, I'm done with this. Some people fight through multiple injuries to get back, but every person's different. But I've definitely seen a lot of people grow through an injury process, for sure.
Yeah, you mentioned a good point with the mental toughness, and I think you can kind of present this as an opportunity to work on areas of your game that are not physical.
Oh, absolutely.
How many athletes truly work on the mental aspects of their game, or the strategic aspects, or even technique of, okay, your legs hurt. That doesn't mean you can't work your upper body, or work on something there. if they are given these little goals, these little targets, as you alluded to, they come back stronger and maybe surprise people.
Oh, absolutely. And that's one thing. When you cannot physically be there, you learn to be a leader in a different way.
Mm,
You learn that the art of visualization and
right.
meditation and different things like that as you go through this process. So you can definitely come back as a better, well-rounded athlete or student athlete coming back from an injury.
You talked about sports specialization being an issue, and I think it's something that has to be talked about more, simply because parents still resist the idea that we should be, we should be putting our son or daughter in this sport exclusively, and not just exclusively, but excessively.
Right.
I could tell you stories, and I'm sure you could tell me stories,
Sure.
but here's an opportunity to kind of provide a rationale for why should we be playing other sports? What's the physiological benefit of doing this? And what is our limit as we are, let's talk about, high school, junior high sports. What is sensible in that respect that gives my child long-term health and long-term success?
Yeah, so at some point your child needs to specialize, right? But is that at 9, 10 years old, right? Once you're starting to pick up scholarship offers or whatever as a junior or senior, sure, maybe it's time to concentrate on one sport. But if you look at the NFL draft, for instance,
Mhm.
people that are taken are athletes. They're not taking good football players. They're taking well-rounded athletes. And if you can look at the data, it's there that I can't remember how many of the first rounders played multiple sports, especially in high school, some in
About
college even.
96%.
Yeah. So, I mean, the data is there. And no matter how good you think your child is, they could always be better by cross training or something. If you just teach them the technique, at some point, athleticism from this kid that just started playing when he was in the 10th grade and he is a good athlete, he can still outshine your kid at some point if he's not a good athlete. And when people are writing these major checks, they want people that are well rounded. You know, even when brands are coming in to sponsor someone, they want someone who's well rounded. They don't want just someone who can throw a baseball fast or hit a baseball far or kick a ball far. So they want well rounded people, well rounded athletes. So it definitely is beneficial to put your child or your athlete into multiple training situations because you can learn from each situation.
Mm. And when you put that perspective into coaches, this is really hard for coaches to accept. If I'm a,
Yes.
a club coach and you're my athlete, I know that if you're going off to play field hockey somewhere, you're not playing soccer with me. And if you're not playing soccer with me, maybe I don't get that check from,
Right.
from the parent that I would otherwise want. Um, is there a rationale here for also for performance success in relation to, if I let you go and, not that I have a choice, but assuming I let you go and play field hockey, it actually makes you better at my game too.
Yeah, I think that if you have your hands on an athlete for only a short period of time, you might not see the full benefit of this kid when he's 12 and you get back to see him again play when he's 16 or 17 and he's moving as a different person. So I definitely think that that is a challenge because coaches want to win.
Mhm.
You know, on some certain levels, your family depends on you winning to keep a job. So it's definitely a tug of war, so to speak, sometimes with coaches to understand that, hey, this kid needs to be taking a season off to rest its body, to train, to cross train, so that we can stretch out that arm so it doesn't get overused and lead to injury. So it is a very difficult topic, but I think communication and so that people can understand all around that we're here for the athlete is the most important thing.
Yeah, and I like providing data too,
Yeah.
just to show, like you talked about the NFL, but as well just data written by people like yourselves who've researched, the rate of injuries in young adolescents and adolescents. And we may want our child to specialize, and they may be a superstar at 13, but by the time they're 19, their knees are toast,
Or
uh,
they're burnt out.
or they're burned out, which
You
is
know.
is also a very valid point. And then by the time they get to college scholarship, they just don't have the heart for it, or they don't have the physical attributes to be successful. It just seems to be we want success now early, and
Yes.
scouts are looking for younger and younger and younger, and therefore parents feel the pressure to have their children succeed younger and younger and younger. Consequence of that, you're kept in, unfortunately, in a lot of business.
You're absolutely right. And many times it's business that, I would rather not have. It's very difficult. I don't want to operate on a 10, 12-year-old kid with an adult injury and know that I have to, they have 5 more years of trying to play sports on a serious injury that, could really jeopardize their future of having a bad knee and needing a knee replacement early adulthood. So I would rather prevent injuries truly than have to treat some of the injuries that we see that could be prevented.
Last question. Masters level athletes are becoming more and more prevalent. I'm fortunate I get to coach pickleball,
Yeah.
and I would say the average age of my pickleball attendee is probably late 50s, up into the 80s, which is fantastic. I love it. It's a lot of fun to do, but then there's also a lot more risk involved because of stability issues and just physical strength and flexibility and so on. Are you seeing more injuries in elderly athletes, given that more and more people seem to be playing through the stages of life?
So yes, I think that people are definitely, the weekend warriors able to continue now and play into their 60s and 70s playing tennis or, pickleball or things of that nature. However, there are some inherent risks that come along when you're playing the sports that young people play, basketball, soccer. I see injuries in 30 and 40-year-olds playing soccer and basketball. I encourage some lower impact exercises at that point. However, there are some people that I've known people to be able to run 5Ks, 10Ks into their mid 70s. Most people will not hold up to that at that point. So I think what I advise people is to just listen to your body. If you're pushing through pain every day, pushing through swelling every day to run a 5K, maybe that's not the best exercise for you. Maybe you need to start looking into cycling or swimming. So really just listen to your body. Everyone's different though. But being physically active is something that I really encourage my patients and athletes to do.
Well, I know you do a podcast yourself, and of course I want to make sure people know about it. So just give us a minute or two explaining what it is, how can we find it, and subscribe.
Sure. So, Time Out with the Sports Doctor podcast is my podcast. It's available across all platforms. It's also on YouTube. And I say that this is where life, sports, and medicine intersect. This is my story as an orthopedic surgeon. I have guests on the show from other athletes to other physicians and entrepreneurs, entertainers. But we really are talking about what does success look like for you? Because I want to be an example that you don't have to be perfect to achieve success, right? So, and it's a personal journey. We work on mindset. We work on helping you strengthen your mindset to attack whatever presents to you, help you grow your assets from a financial literacy standpoint. But really, it's just to give you practical tools to be able to achieve whatever you want to achieve in life.
And just say the name of it one more time for us.
Yeah, Time Out with the Sports Doctor podcast. You can find on my website, Dr. Derek, the Sports Doctor. I'll include that for you. But Dr. Derek, the Sports Doctor, is my website. You can also find me on Instagram or Facebook at Dr. Derek, the Sports Doctor, and my YouTube channel, Dr. Derek Burgess.
Well, you're a busy man, obviously, and I don't want to keep you waiting. But thank you so much, Derek. I hope that people watching in future, if you do have questions for Derek, you reach out to him, and also, of course, subscribe to the podcast. Derek, thank you so much.
Hey, thank you for this opportunity. I really enjoyed it.
All right, just a reminder, every week or so, we have a guest on our show, so be sure to subscribe to the YouTube channel, or, of course, the podcast as well if you're listening on there. But on behalf of myself, Tim Baghurst, and Derek Burgess, thank you so much for watching.
Thank you.